This is Fox 43 Morning News.
You're taking a live look over Lancaster right now at 7:24 on your Thursday morning. So we're talking about summer, right? So a lot of times varicose veins and spider veins, well, it can cause a lot of pain. Sometimes there's cosmetic concerns about it as well. But there's a newer non-invasive treatment to take care of it. So this morning, we're talking to Dr. David Calcagno and Marge Mowry, a patient who has had the procedure. Good morning to both of you.
Good morning.
Thanks so much for chatting with us this morning. So, doctor, let's first talk about varicose veins. What exactly are they, and what kind of problems do they cause? Because it's not just a cosmetic concern, correct?
Correct. Varicose veins are large dilated veins that bulge from the skin surface, and they're caused because the valves in your veins, which normally allow blood flow just up to the heart, are leaking, so the pressure backs down into your legs, which causes a sense of heaviness, tightness, tiredness.
Okay, so there's a new treatment that's coming out that can help with this. Talk about that for a second.
Exactly. When the saphenous vein, which is the main surface vein of the leg that runs from your ankle all the way up to the groin, when the valves in that vein leak and cause back pressure in the legs, typically what we did for 100 years was a vein stripping. It was a big operation in the operating room that Marge has seen herself.
Because not only is she a patient, you work in the operating room as well. Okay.
Correct. And we used to actually strip out that vein or rip out that vein. But now, there's a procedure where by just under local anesthesia, threading a microwave catheter up that vein, you can seal it off. It's done under local. People get up right away, return to normal activities, as opposed to the older way of the stripping procedure.
And Marge, you've gone through the process and you've also seen the process. How different is this from what has been done in years before? Because I'm sure that surgery, the original surgery, is probably a little terrifying for most people.
Oh, right. And it's under general anesthesia, which takes a longer recovery time, and the procedure itself is a lot longer recovery time. I just had it done 3 weeks ago, and I feel great. It's amazing what a difference it made in my life and in my job and appearance, but mostly it was standing for long periods of time, and the heaviness, the pressure. I actually had pain in the sides of my legs, so it's been really good.
And what kind of impact does that have on your life as the pain gets worse and worse? Is it something that really can be...
Fatigue.
Okay.
That chronic pain and aching in your legs and the heaviness really fatigues you, especially after a long day standing on your legs. It made a big difference to have this done, and I didn't realize how much of a difference it was going to make until I had the procedure done.
You don't know how good you can feel until you feel better, right?
Right.
And how long did it take you to actually realize the positive impacts of the procedure? Was it immediate, or do you kind of recover from a little bit of healing first?
A little bit of healing.
Okay.
I have to be honest. It wasn't bad at all, but it did seem to be like after about 2 weeks, I noticed a big difference. First 2 weeks you're wearing stockings, and I think your legs feel a little heavy still. But after that, it's great. I just am really pleased that I had it done.
And doctor, in terms of treatments, is this sort of maybe one of the only treatments available? Is there much else that you can do prior to having to do this, or is it sort of your only option?
Well, when patients have, large varicose veins, first thing we do is an ultrasound. And if the valves in that saphenous vein are leaking, then this would be the procedure to do.
Okay, great. Well, thank you so much for joining us this morning. We really appreciate it. We'll put more information on our website, fox43.com. All you have to do is click on Morning News. You'll find all the information on the procedure. Thanks so much, you guys.
You're welcome.
Thanks. All right, more to come right here on WPMT Fox 43 Morning News, including this story.
The president's